will I get roid rage when I'm on TRT? So for those who don't know what roid rage is, getting really angry, just losing a rag for no apparent reason. We're going to discuss if this is even possible on TRT after this. Right, so we're back to discuss will I get roid rage and what it is, or what it's perceived to be, if I'm on TRT. So what we do know is this, that TRT increases the amount of testosterone in your body through the use of exogenous testosterone. There is a thought, and we think it's a bit more of a myth in the world of anabolic steroids and abuse, that if you take excessive amounts of androgens, you may get excessive conversion to both estradiol and DHT, which may make men more aggressive. Testosterone is thought to make men more aggressive. And the media has overplayed this hype around the fact that you'll just lose your rag, you'll get so angry, you'll throw buses across the... No, you can't really throw buses, but you'll start throwing things out of your pram, and it just is not a good look. Or, you may be in your car, and then you're just going to get really angry. Does testosterone cause this? Or is it caused by something else, a component of testosterone, or do we not even know? And is this something to be worried about? That's what we're going to discuss.
So, there are some studies, I need to find them, where I think they looked at levels of testosterone and things like anger. And actually, it was the shown association between lower levels and men being more angry. And certainly, with the men that I've helped through therapy, that it is all the time. It's a case of when they have low testosterone and they normalize it and they get balanced, that actually they feel happier, calmer, stress tolerance is down again, and then they can manage things. So actually, people become a lot more placid, happy, can deal with what they need to do in their day-to-day life. I think some men can feel assertive again, calmly assertive. And I think sometimes that can be determined or seen by some people. The saying your part assertively and calmly can be seen as being maybe more aggressive, and that word being used, as aggressive, but that's completely, a different description of what calm assertion is saying that something needs to be done, or I need this to be done, or I'm going to do this, and this is important, so I'm going to prioritize that and actually getting it done. So the men often actually report the opposite, that actually they're more angry, they're flying off the handle, they're more anxious, they're lower mood, which is all linked to anger.
Yeah, in fact, in the Adams questionnaire that's used to determine low testosterone, they will say sad and or grumpy. Are you grumpy? And sometimes that is more related to roid rage than just pure, flying off the handle.
Yeah, so when they're talking about roid rage, some of the anabolic steroids, we talked about this briefly in another video, the things that aren't testosterone anymore, that have been changed to be a different substance altogether and not what the body naturally produces, if they're taken in high dosages, they actually can have more of an androgenic effect of increasing aggression, and usually it's applied in sports and physical exertion, training, all those sorts of things in most cases. And those anabolic steroids in some people that naturally are, because you can be an angry person, and if you are taking something that potentially increases aggression and you don't have that cognitive control, you might notice that you're more angry with anabolic steroids, and that has been reported. That doesn't happen with everybody. It can be, people don't experience any of that when they're taking anabolic steroids and not TRT. Now, if you are an angry person and maybe your normality, you just like being angry with people, and then you get your testosterone restored and you're back to your normal self and you're now able to be angry more, you might be an angrier person. That is, you have to think of TRT as you're just restoring what was in the body to an optimal place. So you're normalizing that person, and if that person is a certain way, it's not going to, suddenly go against the whole lifetime of experience and nurture and nature and everything that's formed that person, I would say.
Yeah, no, I think you're right. I think when you first have the adjustments of hormones in you, it's a little bit of a ride. Your things are switching on. You're feeling a bit more alive and alert, and how you respond to that, may in some people give them the appearance of some sort of losing control, but it's highly individual. And in general, most people that started treatment that have reported to us say that they have been a lot calmer. They're not that grumpy old man that they once were, and so things are in the opposite direction of what the media's portrayed, at least with anabolic steroids, which sometimes testosterone gets attached to, and we don't see that as being the case.
Yeah, I mean, at the start of therapy, sometimes in the journey through TRT, it can be quite anxiety-inducing for a lot of people. I mean, even HRT for women, the same thing. So actually, some people, if they're not supported properly through the start of TRT, if they've got loads of worries, there's lots of misinformation and content creation that's sort of aimed around polarizing one way of doing things, or you should be doing one thing, or you shouldn't be using this, and create a lot of anxiety in patients. And then they can get angry, because anxiety is definitely linked to anger. So if you get snappy and angry because you're frustrated and worried about what you're going through on TRT, and you're not supported fully, and you don't have someone explaining, through the journey what you should experience, you might associate with you having started TRT and now being a bit snappier and angrier, but it's actually more the anxiety of not really feeling supported through the journey.
I think that's a good way to look at it.
Yeah. So that was a video on whether TRT will make me experience what people have heard of as roid rage, or make me angry. So hopefully that was a good explanation of our experience and what we see. If you like the video, please click subscribe, ring the notification bell, click like, comment underneath. Otherwise Mike will get angry.
No, I'm very calm, we'll get angry.
We won't put that in.
All right.
All right.
Sounds good.
Cheers, thanks for watching.